What's up, everyone? This is Dr. Webb here. Thank you guys for watching this video. Make sure you subscribe. New videos coming every week. You don't want to miss them. Today, we are going to be discussing some of the things surrounding the coronavirus, and some ways that people can protect themselves. I have a guest, Dr. Littleton. Hey, how are you today, Dr. Littleton?
Doing excellent. Thanks for having me on, Dr. Webb.
Yeah, absolutely, man. And for the people out there that may not know who you are, can you just introduce yourself and tell them who you are and kind of what you do?
Absolutely. So I'm Dr. Jason Littleton. I'm the chair of family medicine at Orlando Regional, and I'm the CEO and founder of Littleton Concierge Medicine. And what concierge medicine is, you may remember from a previous video that Dr. Webb and I did about a year ago. Concierge medicine is private executive medicine, where I work with clients 24/7. They have my cell number, and we do visits through telehealth. We do in-office and in-person visits. So it's really care around them, and we spend extra time with each visit. So it's not 15 minutes, 30 minutes per visit. My clients get about an hour, and it's a very detailed visit.
Got you. And as a spine surgeon, this is one of those things, a pandemic where I'm not directly on the front lines, but I imagine, as a concierge physician, family medicine physician, that, you are kind of on the front lines. Can you speak on that a little bit?
Absolutely. As a concierge physician with the focus of family medicine, we're seeing people in the hospital and outside the hospital, whether it's clinic or in their home. So we're seeing it really in two fronts. And it's very interesting because with the coronavirus, it's actually a very mild virus, but it's a sneaky virus in that, there are some young, healthy people who may have the virus, yet they do not know it because they're asymptomatic. And what's sneaky about that, in a way, they act as vectors, where they can transmit the virus to someone who might have serious comorbidities like COPD, hypertension, CAD, diabetes, or immunosuppression. And these people can get very sick. And so it's very dangerous because you never know in that subset of population, the young population, who may have it. And if you come in contact with them, especially if you're in the elderly population, you won't get it. So that's why social distancing is very important.
Yeah, and I definitely agree. And it's one of those things that, when I first heard of it a few weeks ago, I didn't really realize the impact that it, can possibly have and the seriousness of the condition, the virus, until, hearing all these reports of the fatality rates and the number of cases that are out there. And I concur and agree that, asymptomatic spread is, that's a real concern. How's the status out in Orlando right now in terms of everything, like the hospital?
Well, in Orlando, we're finding a rise in confirmed COVID-19 positive tests, and we're finding the rise in death rates, but still it pales in comparison into the flu. And I want to put that in perspective because while this is a global pandemic, the flu is a pandemic. The CDC illustrated that last year, approximately 80,000 people died from the flu. If you break that down on a per day basis, that breaks down to about 219 people died a day in the United States of the basic flu. And this is something that we have vaccines for. This is something that we have even a medication to shorten the lifespan of the flu if someone has it, like Tamiflu. So that's in the setting of that. That's a big deal. The coronavirus pales in comparison to that. Each year, the CDC thinks that 12,000 to 56,000 people may have the flu. That breaks down, actually, if you want to break it down per day, into about 33 people on the lower limit to 153 people on the upper limit per day in the nation, again, in the setting of vaccinations and things like Tamiflu. So when we putting it in perspective, while the global impact economically has been devastating with the coronavirus, as far as mortality and morbidity, the numbers don't compare. Yet, we're really feeling the effect because this nation has shut down in the time being while we social distance and try to figure out best solutions and practices.
Yeah, and like you said, the asymptomatic portion, I'm wondering if the numbers will be a lot higher once they start testing a lot more people. There's certain parts of the U.S. that don't have the testing capability, if these people are tested, will that mortality or that fatality rates actually decrease because you have more people that have the disease and less people that are dying?
Absolutely. You're 100% correct. We found that in China. As they tested more, the mortality rate went down. And that's what we expect here. We expect as that denominator, the more tests you do goes up, we expect the mortality rate to go down. Now, what some people might be alarmed at is that you'll find more positive tests, okay? But that doesn't necessarily influence that the mortality rate. Again, the mortality rate's affected by people who have COVID-19 and who succumb to it because of either severe complications or the virus itself. So as we increase the number of tests, we increase the number of positive tests, and that can be alarming. You might feel like everyone down the street has it. And in a way, in a degree, that might be true, because this is somewhat like the common cold, and that there's not a treatment for the common cold. I don't think that we're going to eradicate COVID-19. I think it's here to stay, but it's a new social norm, and it's about how we go about certain social distancing practices, sanitization, and disinfection practices that will make a difference.
Yeah, I definitely agree. I've heard some news reports of the discussion around people, getting the coronavirus as well as reinfecting themselves or getting it again. Like you said, it's kind of like the common cold or the flu, where it kind of mutates, and if you get it one time, and it's not saying that you can't get the the virus a second or even third time. So there's starting to be discussion around this cyclical nature of it, and whether one person gets it multiple times. So
yeah, no, you're exactly right. On your side of things, how's it going over there in Texas?
Yeah, and here in Texas, there are a couple of hundred cases of the coronavirus, actually. A lot of the hospitals have, postponed more kind of general cases. And the only cases that they're allowing us to do are more of the elective cases and kind of the emergent and trauma cases. So a lot of people are taking precautions here at the hospital. You're getting your temperature checked when you walk into the door. They're asking you the screening questions in terms of, do you have shortness of breath or cough or fever? And everyone's wearing a mask, and also some people wearing gloves around. So people are really taking heed to the suggestions and recommendations from the our officials. So everyone's on alert, everyone's on lockdown. Basically, you can't go out of your house unless you're going to a hospital or going for a walk or something like that. So
that's very interesting. An important question that I know from the primary care side that we have for you that would be really interesting to know is, when we talk about masks, you see a lot of people wearing masks, surgical type mask, and you're familiar with that. You wear them all the time in surgery. Now, there was recently an article out that sometimes those masks aren't as safe as we think they are, even in the surgical setting. I came across that, and so I was wondering if you could give some light on that. As you see people out and about with surgical type mask on, how effective is that? And can you maybe relate that to how effective that is when you're in surgery right now?
Gotcha. All of my information I usually get are from, really reliable sources like the World Health Organization or the CDC. When they first came out a few weeks ago, they suggested that the only people that should be wearing masks are the people that are in close contact with someone who had symptoms, or if you have symptoms yourself. Now, over the last few weeks, things are very dynamic and things are changing by the day. There's more recommendations in terms of wearing a mask at all times now for, a lot of different places, especially hospitals. And then there's some reports out, if you don't have a mask, wear a bandana or some type of makeshift mask. There are some reports out there of you actually, if you have a mask on, you're more likely to touch your face. And, what is to say that this mask that you're wearing, if it does, have the virus, and we know that the virus can stay on certain surfaces for hours and up to even days. And you take this mask off and you're touching your face, or you're touching your glasses. So are the masks really that effective? I guess that's my question for you as well at this point, for someone who
Well,
has
great question.
no symptoms at all.
It's been shown that the virus can stick on surfaces, whether cloth, metal, or even glass, for 2 hours to 9 days. So when we talk about wearing the surgical mask, when you see people out and about who are not clinicians wearing that mask, I would err on the side that it's not very protective, because if the virus is on the mask and you touch that mask to adjust it, because you're not wearing a mask 24/7, at some point you may subconsciously, and we all do this, touch our face, rub our nose, rub our eye, and we're putting ourselves in a situation where you can possibly set yourself up for infection. And, you know, even if you touch the mask, touch a door handle, again, you pass it right on the door handle. Actually, there was a very interesting TV show, Scrubs, that did a parody on passing infection, where someone would pick up a tissue off the ground and not notice it and shake someone else's hand, and that person would not touch someone's shoulder, and someone would, you know, give a pat on the shoulder and touch another door handle, and it just passed all through the hospital. And that's very true. And so with the surgical mask, the best thing that I would recommend is we want to save that for the medical personnel. And if you're sick, if you actually have a cough, that's when that mask actually comes in handy, because then you don't spread the cough as much because you're coughing into the mask. And so people who are under the weather should be social distance, but they should wear a mask at that time, especially if they have loved ones around. So that's when I recommend it. Me personally, I do not wear a mask, you know, out and about. But when I am seeing patients, I will wear a mask, because you don't know who has COVID-19. And I want to be careful for other healthcare personnel and my family as well as myself.
I totally agree with that. You know, you spoke about the asymptomatic spread of this. Someone may have coronavirus and may not have any symptoms. And if you're in contact with them, or you're touching or not using gloves, you know, you can very easily, you know, spread that. And it's very true that we touch so many things throughout the day, and a lot of people are more cognizant of this now because of everything that's going on. But as I'm walking here, you know, I was like, wow, I touched this door, I touched, you know, my laptop, I touched my phone, touched my glasses, you know, I touched my wallet not too long ago. So there's so many things that, you know, you can touch, and that this virus can easily kind of spread. What should we be doing at this point in terms of protecting ourselves and protecting others?
Well, what I've been telling my clients, and what I've been also speaking about through the media, is that the best thing you can do is obviously wash your hands many times. Wash them before you eat. Wash them before you wash your face. Wash them, you know, anytime that you think you're going to come in contact with elderly people, young children. And one of the things that I've also been giving as far as tips is personal hygiene. It's very important that people at this time take at least 2 showers a day, especially as clinicians. When we go into the hospital, we want to make sure that before we come home, we kind of disinfect. That means wash the clothes that we wore, take a shower, because if it can get on our hands, it can get on other parts of our body. And we want to make sure that we're protecting our loved ones and people that we're seeing post-hospital. Other things that's very important is, look, if you have chronic medical conditions, make sure that you're staying on top of them. If you're a diabetic, check your blood sugar. Make sure it's even killed. We want to make sure that your blood sugar is appropriate. We do not want to put yourself in any further risk than need be. If you have COPD, if you have asthma, stay on top with using your rescue inhaler, your inhalers. Let your doctor know if you have any type of respiratory distress. If you're a smoker, this is the best time, if any, to stop smoking, because we know that smoking impairs lung function and it hurts your immunity. So if you come around someone who's infected with COVID-19, the best thing you can do is reduce smoking so that you can protect yourself. Other things that are really important is make sure that you're compliant with medication, make sure that you're connected to your doctor's office. These things can make a difference. There are over-the-counter supplements that people talk to me all about. I always say consult your doctor. What I do personally, and this is just what I do, I personally take vitamin D, I take vitamin C. I take these things because I know that they're important to immune health, they're important to chemical reactions in your body, for your body function to operate appropriately, and I don't want to be deficient in these things. I take zinc because you don't want to be deficient in zinc. some studies have shown that zinc actually inhibits RNA replication of viruses. So these are just things that I do, along with doing my acronym move, eat, drink, sleep, making sure you're exercising, getting good sleep. And I call something what I call stretch out sleep. Stretch out sleep is when you find some day during the week, when you go to bed at night, where you can at least get that 7, 8, 9 hours, that stretch, uninhibited. We might not always be able to get that, but it makes a difference as far as our immune health, how we feel. And it's important to get that in. That might mean some people have to go to bed earlier in order to get that in if you wake up early. So
Yeah,
those are some of the things that can make a difference.
yeah, I definitely agree. You spoke about the medical conditions that place patients at risk, but also just taking care of ourselves in terms of physically. Even though the gyms are closed, but I try to still walk anywhere between 2 to 5 miles per day still, and like the vitamins that you suggested, taking multiple showers, coming home from the hospital where there's no active cases at this hospital, but I still strip down in the garage, make sure that the scrubs that I'm wearing, that I don't transmit anything into the house. I have a newborn at home, so I don't want to get him sick. And I shower. So sometimes I shower now 2 to 3 times, per day, just to as a precaution. So, all of these things are important. You just have to be really vigilant in terms of, things that you're touching and what you're doing throughout the day to mitigate that risk.
It's something that you definitely have to be careful and practice universal precautions. An important question that I have from you is, one of the things that we're seeing, and we're seeing a lot in the media, is the oversaturation and really the overwhelming of the hospital medical systems. Right now, there's a feeling that a lot of hospitals are really they're running out of beds, running out of ventilators. And this is true. This is true. No doubt about it. Right now in my hospital, what we're finding is that with the stay-at-home mandate, we have actually seen fewer people with common problems come to the hospital.
Yep.
And we're saving beds for people who have COVID-19 or suspected COVID-19. We have reduced the amount of surgeries that are done unless they're emergent. We've actually we stopped elective surgeries so that we can, again, save beds and save resources. Can you speak to this stoppage in surgery in regards to elective surgery, and when would surgery be appropriate, and what kind of things are you on call for in this new normal?
Yeah, so elective case is a case that I would say not urgent, or something that even if you had it done, today versus 3 months from now, there's really no difference in terms of outcome. Any patient that has neurologic deficit, or if they have progression of motor weakness or numbness, tingling, epidural hematomas, which are collections of kind of blood or fluid kind of compressing the spinal cord, or if a patient has a condition called cauda equina, which means that they have compression right at the inferior portion of their spinal cord, which can cause some bladder and bowel symptoms, paralysis, weakness, pain. Those are the more kind of urgent cases for us. Unfortunately, a lot of the surgeons that have primarily a elective practice, they're taking the hardest hit from this, just because if you do, joint replacements or ACL surgery or carpal tunnel surgery, those are kind of the elective cases that, should not be going to surgery at this point. The other cases that we're doing are trauma cases at our level 1 trauma center here. So any patient who gets into an accident, and, most people should be staying home these days, but, accidents still occur. People are experimenting with different things at home, or climbing up on the roof and hey, I'm gonna go clean my roof today, and then fall down and break their hip. Well, that patient needs their hip replaced in an emergent setting. So those are the types of cases that we're still doing.
Yeah, no, very good. The other day, there's a report out of England where some doctors have found neurological symptoms that may be associated with coronavirus. And this may be somewhat anecdotal, but, there's a lot of medical logic to it, where people have observed that some people lose the sense of taste and the sense of smell as somewhat of a precursor with the coronavirus. And I'd like to speak on that. Before I do, I'll just add that one of the things that's interesting about this is that, while this is not proof that someone has the virus,
Yep.
these symptoms are also associated with allergic rhinitis, and they're also associated with a common cold, where sometimes because of the inflammation in the nasal passageways around mucosal nerves, sometimes people do lose the sense of taste because they lose the sense of smell. If you pinch your nose and you bite orange, you're not going to actually taste that as well. And we call loss of sense of taste dysgeusia, and we call loss of sense of smell and nausea. And so I was wondering, in that article and other articles that I've looked at, what is interesting is if it can cause that, and if the virus can even possibly infect nerve cells, it might be able to travel its way to the brain. Again, this is somewhat anecdotal, but what are your thoughts about that? Have you heard anything on that?
That's really interesting that you say that. I have not heard anything about the kind of the virus kind of affecting the brain and spinal cord, which neurosurgeons focus more on brain and spinal cord, and orthopedic surgeons, spine surgeons focus more on the spine. I haven't heard anything like that, but it's one of those things that we have never seen this virus before, so a lot of people are trying to figure out what's the best treatment for it, how can we prevent the spread of it, and vaccinations and things like that. So we just have to make sure that there's ongoing research to kind of study this virus and what parts of the body that it's affecting. There's some literature in the GI literature that shows a lot of patients can show up with abdominal pain or diarrhea.
Interesting.
Vomiting.
Yeah.
So I saw one study that was that reported 50% of their patients almost reported those GI complaints. So new developments, things are going to be coming out about how it affects different parts of the body mentally, and that's one thing that hasn't been talked about a lot. How is it affecting everyone's mental status in patients who have depression or anxiety? So a lot of new developments probably will be coming out in the near future about it.
Yeah, well said. Well said. Yeah, we are, what people have to understand is, as doctors, this is a novel virus that we are learning and studying every day. Every day there's new updates. Every day we're learning about new manifestations. This is not something that the medical community has a corner on, like maybe other medical entities, but we're learning every day. We're trying to find out what are the effective treatments. Right now, medications like remdesivir and even chloroquine, hydroxychloroquine are being fast-tracked, while they've been approved for other modalities, remdesivir for Ebola virus and hydrochloroquine and chloroquine for malaria treatment and prevention. We're looking at how we can best stop this virus, because we know that providing hope through treatment can help increase the economic upturn and get America back to work. I want to just add, for people who might want to learn something about the viruses, that coronavirus is within a family called Coronavirudae. And one of the things that I want to point out is that there was a SARS virus in 2002, 2003, that was what we call SARS-CoV-1. We knew about that then. And then there was a MERS virus, Middle Eastern Respiratory Virus, in around 2012, 2013. And this is called SARS-CoV-2. And what we're dealing with, SARS-CoV-2, also known as COVID-19, or coronavirus. And these are different viruses. All these viruses are within that family that I mentioned. And the word corona comes from a crown, or even the sunburst of the sun. So that's what some of the nomenclature and the names are, so that we can be informed here. And so this is a novel virus. I know it can seem scary because everyone's out of work and things like that. But you know what? It pales in comparison to the flu. We have to protect ourselves, isolation. And I just wanted to do maybe a little bit of a recap for some of our viewers. But one of the questions, and I know, soon we're running out of time, but one of the questions I wanted to ask you as a surgeon is, what will be the new surgical normal after this is over?
Yeah, I think a lot of hospitals are, taking heed to what's going on. And I think a lot of surgery centers will make sure that their hospital, their ASC, ambulatory surgery center, and a lot of the other kind of medical centers around are prepared for something like this in the future. So it's one of those things that just, hit everyone and hit us really hard. And a lot of people were not prepared for this. But in terms of surgery, I think, more research in terms of, surgical masks, should we be wearing those? I've seen some reports out in the past, even before this even started, should we wear surgical masks? And we kind of talked about that as well. They did a study looking at surgeons who didn't wear their mask and surgeons who did wear their mask, and there's really no kind of increase in infection from that. So I think more kind of studies from the personal protection attire, as well as kind of the mass casualty planning, that disaster management planning, things like that in the future. So I've been hearing reports about, they said that Black people cannot get coronavirus. What are your thoughts on that?
No, that's not true at all. So, this virus is non-discriminatory, and basically we're talking about the virus spread through droplets, okay? And people of all races need to be aware of that. While it's a mild virus and people who are healthy, people under the age of 10 aren't really affected as much in terms of symptoms, they can still spread it. And they may have elderly loved ones who, if they get it with their comorbidities, perhaps could succumb to it. There have been reports of many African American people who have died from comorbidities and being COVID positive. So that's simply a myth. It's not true. And again, the virus is not looking at color here. It's really, a virus is a terrorist, and it's looking for any host that it can occupy and replicate and spread.
Yeah, exactly. I definitely agree with that. People talk about malaria, and as well as, sickle cell disease and that kind of association. And there were some things out there online, false information. And I wanted to just kind of clear that up. And I agree, it's totally not true. It's one of those viruses that does not discriminate who you are, how much money you have, or where you went to school or where you live. Everyone's at risk, and we should all be taking the necessary precautions
Exactly.
to protect us, and as well as those patients that are kind of vulnerable. So, but Dr. Littleton, I want to say thank you, man. And where can people find you if they want to reach out to you?
Best way to interact with me again is jasond.com. You can work with me and interact with me on Instagram at Dr. Jason Littleton, or Facebook, Dr. Jason Littleton.
All right. Thank you, Dr. Littleton. And we'll talk soon, man. Stay safe.
Thank you. Thank you. Be safe.
Everyone else, thank you for watching this video. Make sure you subscribe. New videos coming every week. We'll see you next time.